Hart. Okay, so I now take the statement for the meeting of the Social Work Resources Committee of 16th November 2022. In the meeting, I have Councillor Alex Allison. I have apologies for John Bradley. In the meeting, I have Councillor Walter Brogan. Apologies for Robert Brown. I have Councillor Buchanan, Archie Buchanan. Can't see in the meeting. Is he in the meeting? No Councillor Buchanan. In the meeting, I have Councillor Matthew Buchanan. Janine Callickis. I have apologies for Councillor Moyden Devlin. I have Councillor Mary Donnelly in the meeting. Councillor Fagan. Can't see Councillor Fagan in the meeting. No. Present, I also have Councillor Alan Faulkner and Councillor Elise Frame. Councillor Lindsay Hamilton. Won't have Councillor Hamilton in the meeting either. Present, I have Councillor Celine Handybode. Councillor Horn. I have Councillor Horn present. Present, I have Councillor Mark Horsham. Councillor Hose. I don't see Councillor Hose in the meeting. I have present Councillor Cal Johnston Dempsey and Eileen Logan. Apologies from Councillor Hugh MacDonald. And present, I have Councillor Catherine McClymont. Apologies from Councillor Richard Nelson. Councillor Carol Nugent. Councillor Nugent in the meeting? Yes, we do. Apologies from Councillor John Ross, and also present we have Margaret Walker and David Watson. We also have present Councillor John Anderson, substituting for Councillor Ross. Councillor Maureen Chalmers. I'm just checking Councillor Chalmers is in the meeting. Yep, substituting for Councillor MacDonald. We have Councillor Margaret Cowie. Councillor Cowie, I'm not sure who you're substituting for. Can you confirm?
Can you hear me, Tracy?
Yeah.
I'm substituting for Lindsay Hamilton.
Thanks, Councillor Cowie. Okay, and also have in the meeting Councillor Mark McGeever substituting for Councillor Robert Brown and Councillor Davy McLachlan substituting for Councillor Maureen Devlin, and I'll hand back to the Chair. Thank you.
Thank you, Tracy. People will have noticed we have some guests with us this morning that we're very pleased that are here. I will pass over to Suman, who will give you some of the background in relation to the guests and recent awards that they have been successful in winning. Thanks, Suman.
Thank you, Chair. Good morning, members. Our care services, our staff, our teams, our partnerships continue to be challenged like never before. Facing those challenges and doing the best that we can by local people and communities relies on our staff collaborating, innovating and having drive. It also requires that work and our staff to be valued and celebrated by elected representatives and committees such as this, and it's always been very reassuring to me as Director that that's been a strong message from the members of this committee. With that in mind then, and with the support of the Chair, I'm thrilled to be able to highlight areas of collaboration, innovation and drive that have received national recognition in recent weeks, and to provide this committee the opportunity to thank some of the colleagues involved directly here today. So, on my left then, I'd like to introduce you to some colleagues. Firstly, many of you will know Annette Finnan and also Brendan Connor from Housing and Tech, as well as our colleague Evelyn Devlin from the HSCP, who are part of the team who've been delivering our Blantyre Care development. Now, as members will remember, a key element of that has been our technology-enabled housing, and I'm thrilled to be able to let members know here today that that development won the Award for Excellence in Health and Wellbeing at the recent Chartered Institute of Housing Excellence Awards. Evelyn is also here to represent our Pan-Lanarkshire Care Home Wellbeing Group, which was a finalist at this month's Scottish Health Awards. That's an area work which is undertaken across South Lanarkshire Council, North Lanarkshire Council and NHS Lanarkshire in collaboration support with independent providers of residential care right across both authority areas. At the Scottish Health Awards, we were thrilled that our Home First initiative in service was also recognised and won the Integrated Care Award in a very competitive category. And I'm really pleased that our colleague Andrea Tannehill is able to join us here on behalf of not just the direct team involved in that, but the extensive groups of staff who've supported a clear area of innovation where, frankly, we're becoming a sector leader across Scotland. And finally, I would like to introduce you to Megan Cassidy and Laura Arthur. Megan Cassidy was a finalist in the Bright Spark category at this year's Scottish Social Services Awards, and Laura won the award for Leader at those same awards. I'm exceptionally proud to be in the role I am. It's a real privilege to do this job, and one of the reasons it's a real privilege is because I get to work with individuals and teams such as those here today. Times are exceptionally challenging. These accolades, however, are concrete evidence of outstanding achievement and exemplary professionalism. That is the source of renewed confidence and bodes well for whatever twists and turns we have to collectively negotiate in what is a difficult set of circumstances ahead. I hope the committee members will join with me in congratulating them and also to express our thanks to the wider teams that they're part of. Thank you. Committee will also be pleased to know that, again, with the chair's support, we're now going to let our colleagues escape from the meeting because they all have very busy things here to do. So my thanks to all of you and my thanks to committee members.
Thank you, Suman. We'll move back on to the agenda. And item 1, declarations of interests. There's none. Item 2, do people agree the minutes of the 7th of September are approved as a correct record? Agreed? Yep. Okay. Item 3 is the revenue budget monitoring for 2022-23 for the period 1st of April to 7th of October 2022, pages 21 to 28 in your papers. And I would invite Hazel Goodwin to speak to the report. Thank you.
Thank you, Chair. Good morning. The purpose of the report is to provide information on actual expenditure against the phased budget for social work resources financial year 22-23, and it's the period 1st of April 2022 to 7th of October 2022. And this is the second revenue monitoring report we've brought to committee for this financial year 22-23. If I could refer you to section 5.1 of the report on page 15 of the report, we note that as at the 7th of October 2022, there was an underspend of 0.012 million against the phase budget. There are underspends in adults and older people services, performance and support services and justice services, and that is offset by an overspend in children and family services. At section 5.2 of the report, we note there that within children and family services, budget pressures are continuing, particularly on external placements. As I noted, the overspend is being offset in part by the overall social work resources budget and also in part by an underspend in adults and older people services, which, as you know, is delegated to the IJB. Work has been undertaken within the service to try and find funding solutions for the residual overspend. In 21-22, some of the core adult and older people budget underspend was retained by the Council to help cover the children and family pressures. And the same approach has been proposed to the Health and Social Care Partnership for 2022-23. We note also at section 5.3 there are likely to be further underspends in relation to specific funding streams in adult and older people's services, where spend has not started or is not yet fully committed. Predominantly, that is the underspends related to recruitment challenges we're experiencing at the moment. Finance services within the Council are currently in discussions with the Chief Financial Officer and Chief Officer of the IJB and await confirmation of the anticipated position. We'll report that back in our regular reports to committee. As detailed at section 5.2, the Council may look to this underspend to assist in managing the pressures within children and family services, but as noted, that is under discussion at the moment. If I could refer members back to section 2 of the report, committee is asked to note the underspend of 0.012 million and also to approve the budget variants that are included within the report. Thank you.
Thank you, Hazel. Are there any questions, comments? No. Do we agree the report?
Agreed.
Thank you. Item 4 is the Capital Budget Monitoring 2022-23 for the period 1st of April to 7th of October 2022, and it's pages 29 to 32 in your papers, and I would invite Lorraine O'Hagan to speak to the report. Thank you, Lorraine.
Thanks, Chair. Good morning, Committee. This is the standard Capital Budget Monitoring Report, and it's the second for financial year 2022-23. And as the Chair said, it takes us to the 7th of October, which is our accounting period 7. Section 3 gives you the background to the report, and as usual, it explains how the budget's made up. So it's based on the overall capital programme for the year that was presented and approved by the Executive Committee at the meeting on the 29th of June, and any updates and adjustments that we had approved by Executive Committee in August. In terms of budget changes since the last committee, there have been none, so we're static budget from last committee to this one. Section 5 details the financial implications, and Section 5.1 notes that the Resources total capital programme for the year is 3.903 million. And finally, Section 5.2 notes that anticipated spend was 2.986, with actual spend to the 7th of October totalling 2.931. So we're 59,000 behind profile, and it's simply reflecting the timing of spend in relation to the Blantyre Care Facility project, but there's no issues to note in terms of our delivery model. The details are noted in Appendix A on page 31 for your information. If I can then refer committee back to the recommendation section 2, the social work resources budget of 3.903 million and spend to the 7th of October of 2.931 million be noted. Thank you.
Thank you, Lorraine. Any questions, comments? Councillor Faulkner.
Thanks, Chair. It's just on page 31. Care facilities, over £2 million. What care facilities is that?
There we go. That relates to the Blantyre Care Facility. Thank you. The Blantyre Care Facility. That relates to the Blantyre Care Facility. The social work establishment in Blantyre, yes.
Thank you. I don't see any more questions. We agree the report?
Agreed.
Thank you. Item 5 on your agenda is Workforce Monitoring, July and August 2022, and it's pages 33 to 40 in your papers. And I'll invite Eileen McPake to speak to the report. Thank you.
Thank you, Chair. This is the standard Social Work Resources Workforce Monitoring Report covering the period July to August 2022. So section 4.1 outlines attendance statistics for committee, and the details are in Appendix 1. So the absence rate for the resource for August was 7.5% compared to a council-wide figure of 4.4%. This is decreased compared to the previous month and compared to the same period last year. Taking into account all the absence figures, the projected annual average for the resource is 8.1% compared to a council-wide figure of 6.1%. Moving on, section 4.2 to 4.5, the details are in Appendix 2, and the main points during the period are that there were 256 occupational health referrals, there were 4 disciplinary hearings, 2 grievances and 1 dignity at work issue raised. There was 26 accidents and incidents recorded during the period, and during the period there was 27 leavers and 56% of them completed exit interviews. Details of vacant posts are in Appendix 2A, and there was 46 posts that became vacant during the period, 45 will be filled, and there was another one, it says in the report, that was held pending a review of service, but actually it was attached to a funding stream that is now ended. So I'm referring committee back to section 2.0 and asking that the workforce monitoring information for social work resources for the period July and August be noted. Thank you.
Thank you. I don't see any comments or questions. Can we agree the report?
Agreed.
Thank you. Item 6 on your agenda is the update of the 2022 Risk Register and Risk Control Plan, and that's in pages 41 to 56 of your papers. And I would invite Craig to speak to the report. Thank you.
Thank you. So, just to run through the report, folk will be seeing at 3.5 that we have reviewed the top risks, the comparison with 2021, the update on our insurance hotspots, and the update on the risk control actions. Further detail is then provided at 4.1 of the 5 top risks, namely workforce, meeting the public protection and legislation requirements, the market and provider capacity, funding and budgeting supply issues, and overall demand pressures as well. And you will see that these are detailed in Appendix 2. Moving on to 4.3, you will see there listed some of the wider series of system-wide risks that have got the potential to impact on social care delivery. Whilst at 4.7, you will also see that we are proposing a change to how we report these, recognising that the risks are particularly dynamic, and accordingly we will be bringing an updated risk report to all Social Work Committee meetings as we go forward. Paragraph 5 highlights the review of the risks in comparison to 2021, and again these are provided in more detail in Appendix 3, whilst paragraph 6 gives the detail of the insurance hotspots and number 7 of the control actions that we have undertaken throughout the year and the fact that we have completed all those control actions. I would then take the committee back to paragraph 2 and ask that you note the detail of the report. Thank you.
Thanks, Craig. I have a question from Councillor Frame.
Thanks, Chair. First of all, I'd just like to thank and praise the work that has been done to get these papers together, especially during this challenging time, and they're very valued papers. My first question is item 6 and it's page 51. What is the uptake of vaccines amongst our staff? And if this is lower than previous years, what are we doing to encourage our staff to get vaccinated, particularly important given our current staffing issues across the service?
Okay, so I can talk more about that under the winter planning paper as well, but just to confirm the detail just now, we are currently sitting ahead of the national average around our social care staff uptake, albeit we are behind the national average in terms of our frontline healthcare staff vaccination uptake. I would need to say that those are still very low in comparison to what we would want. I think we're currently sitting around 26-27% for our social care staff and around 36% for our healthcare staff, albeit these figures are changing by the day. We specifically protected the first 2 weeks in September to provide the first opportunity to get vaccines for those staff, frontline social care staff and healthcare staff, and we protected those 2 weeks. We communicated that across the range of our staff groups to try and maximise uptake. But again, as has been described nationally, the uptake wasn't there that we'd hoped there would be. In recognition of that, we have now created drop-in clinics at all of our community vaccination centres for our staff, and we have also created dedicated staff clinics at each of the 3 acute hospital sites. Again, we have communicated that widely. There is an email going to all staff in social care to try and urge them to get their vaccinations. And likewise, we are pushing that through the NHS staffing as well. There's also a national vaccination campaign that is again promoting the fact that it's not too late to get vaccinated and trying to push that. There's a bit of work being done by Public Health Scotland to understand why the numbers have come down this year in comparison to other years, and I can provide further detail on that, maybe out with the meeting if that would be helpful.
Thank you. I have Councillor Watson.
Thanks, Chair. Referring to the workforce availability and capacity, can we maybe get an update on where we are with that and how successful or not the initiatives of the sample controls that have been taken to try and increase the workforce, and maybe an idea of how confident you are that we can get the workforce up to the required numbers in the not too distant future? Thanks.
Thank you. I can respond to that. So you'll be aware that obviously at the last Social Work Resources Committee we did report the resource workforce plan, and following on from that the council-wide workforce plan was then reported to Executive Committee, and it was agreed then that in terms of actions associated with the workforce plan which should address the issues that you're highlighting in relation to workforce availability, will be incorporated into workforce monitoring reports so that it enables the actions to be monitored and reported back to members.
If I could come in on that as well, Councillor Watson, just to link this to a wider point. You'll recall me saying this in previous meetings in respect to risk. So we've got a range of controls here that we're doing our best to mitigate these substantial risks, but mitigation is the same as removal. So your last question there was about our confidence in when we could get the staffing levels up to the required levels. I can't give that guarantee to this committee. Frankly, nobody across Scotland or indeed the 4 nations of the UK can give those kind of guarantees around workforce supply at the moment. One of the reasons why this is so high here is that there are real supply challenges. So as colleagues have highlighted before, we've got active recruitment across all of our areas. Indeed, we've got a number of papers here today which will talk about areas that we're looking to boost our capacity in terms of some key service areas. However, when we talk about there being a social care crisis, fundamentally that's a crisis of availability of people to do the work. And so that continues to be a real challenge for us. So we are doing our utmost, and we will continue to bring reports to this committee and indeed other areas to can provide us reassurance that we're doing everything that we can with the resources that we've got. But as I said, it would be irresponsible of me to actually give any kind of assurance to this committee or indeed any member that we'll be able to get ourselves up to the level of optimal staffing required for all of our services, given the challenges we face. We will do our best, though.
Thank you. I've got Councillor Faulkner.
Thanks, Chair. Just a couple of points. It's good to see we've changed our support of our frontline staff, because if we think back to the shielding, when the shielding was lifted and all the old buddies were getting visited with their sons, daughters and grandwains, we didn't make any provision for our home care staff to get tested. They were in and out of there, but we've now put in place that staff can get vaccinated. And I've got to say I've been at 3 or 4 different through my work and through personal. And the last one at Edelwood was one of the best run ones I've been at. But another point in that, I hear quite a few stories from people who have had the vaccination and the flu vaccine about being ill. Myself, I was ill for 1 day. Other people have been ill for 3 or 4 days and weeks. Do we have any records of that? Thanks.
Yeah, so just to try and put that in context, I think it's fair to say everybody's heard a story about the one reaction to somebody's vaccination. We're just approaching just now having delivered 1.75 million vaccines across the population in Lanarkshire. When we look through our adverse reactions, it comes down to something like 0.0005%. So there are lots and lots of evidence that getting your vaccine is very much the thing to do. For everybody that gets a vaccine, there'll be the odd person where there is some reaction, but overall it is generally very, very low. We have also got dedicated clinics for people who are known to suffer allergic reactions, and we've also got a clinical portal that allows anybody who's got any concerns to flag those up, such that we can make sure that we've got due provision for when they're getting vaccinated next time round. But as I said, we're approaching 1.75 million vaccines that we've delivered over the last 2 years. So it's a huge number. Please encourage everybody to get their vaccine. COVID is still out there, and the reality is that flu this year is, if it's following the trends that we believe it is, which is linked to what's been seen in the Southern Hemisphere, it's both more infective and more harmful. And we're already seeing people with flu earlier this season than we have in years gone by. So please encourage everybody to get their vaccination.
Thank you. Councillor Watson, were you wanting to come back in?
Yeah, thanks. It was just to come back on some of the responses and the workforce availability. I accept that we're in a position where it's hard to recruit staff and accept that there's plans in place. I think where I'm coming from is some of these initiatives have actually been up and running, and what sort of response have we had from them as early indications of are they being successful or are they not, and we need to look at other initiatives. Thanks.
I can certainly respond from a recruitment perspective. Again, at the last Social Work Resources Committee, Scott provided examples in terms of the home care recruitment, and we've been doing quite a number of initiatives, particularly in relation to home care, and we actually are finding that we are getting an increased number of applicants. In addition to that, across the council, we are looking at revised recruitment practices in relation to social media, and again, yes, we're seeing people that are applying by offering more flexible contracts, for example, by actually getting out there and attending things like jobs fairs. So recently the council held a number of jobs fairs towards the end of August, and there was over 700 people that attended those jobs fairs, and of that there was around 350 applications. Some of them are still going through the recruitment process, but a number of them have turned into successful appointments. And we're looking at all of these practices and utilising them and speaking directly with hiring managers just to make sure that we're getting everything out there. So we are seeing an increased number of applicants, and what we're trying to do is trying to make that process more smooth and streamlined so that we can get people into post as soon as possible. But as has been stated before, this is a national issue. It's not unique to South Lanarkshire, so it is something that we continue to address and continue to improve.
Thank you. I don't see any further questions. Do we agree the report?
Agreed.
Thank you. Item 7 in your agenda is Planning for Winter 2022-23, and it's pages 57 to 68 in your pack. And I would invite Craig again to speak to the report. Thank you.
Thank you, Chair. So I won't go through the full detail that's in the report. It's quite a lengthy report, but I will highlight a number of issues that I think councillors will want to hear. So the first issue is that what you see before you is the result of a multi-agency, multidisciplinary planning process that commenced in the summer, in July. And the report also recognises the significant unpredictability and the potential issue of concurrent risk this year like we have never seen in previous years. We've just touched on the instance of flu. COVID is still in the community. There's also the potential for something called norovirus, which can have major impact on bed availability across the hospitals. There's weather, industrial action is also something that is a real consideration this year that we don't yet know the impact of, and in turn then makes our planning all the more important. But similar to what Suman was saying previously about the workforce availability, we can't sit here and give any guarantees that plans we have put in place will not result in some disruption to services over the period. There has been significant national guidance issued over the last 2 months. The good news from our perspective is that our plan pretty much picked up the majority of the good practice that was contained within those different pieces of guidance. And indeed, we have emphasised and prioritised some of those areas where we have thought that appropriate. And you'll see throughout the report the range of actions that we've got to support flow through unscheduled care in the hospitals in particular. This is where patients attend A&E in an unplanned way, and we have thereafter got to provide the right care and associated flow through the hospital. And having looked at that process, we have identified that utilising our discharge without delay process and the associated planned date of discharge are the areas that we recognise will give us the most flow through the system. And that is key to what we're facing at the moment, and indeed throughout the winter, is maximising that flow through the hospital, through home care, through placements to care homes, and generally trying to make sure that we have got the right level of care for people at the right time. So 4.3 goes into significantly more detail around the concept of discharge without delay. And you'll previously have seen reports that have come through Social Work Committee, and indeed we have taken reports through the IJB. And associated with that are things like our introduction of more enhanced end-of-life care provision and dedicated end-of-life pathways, additional carer support, and indeed further engagement and support from our third sector partners as we plan for this coming winter. 4.4 provides some of the detail around the modernisation of care at home services that has been undertaken in recent months, and in particular I would draw your attention to 4.4.3, where we highlight the requirement we need to do the assessment and ongoing reassessment of individuals' needs. That's so that we are ensuring that the care packages that are being provided are still appropriate, but it also potentially allows us to release some capacity that could be made available to support others who are in need of care as well. We have highlighted within the report some other areas that we will be utilising to support our winter plan, such as the expansion of the Flow Navigation Centre, additional surge capacity, the GP opening that we're going to have on the fourth day of the public holidays at Christmas and New Year, and we're also going to have practices open on the Saturdays through January. This is something that is unique to Lanarkshire. It's entirely voluntary for the GPs whether they want to do that or not, and as things stand at the minute, we've got roughly 50% of the population who will be able to access those services through their GPs. We have also created capacity for the potential for additional deaths. You might have seen that highlighted in the national press a few weeks ago. Again, that's part of the planning that we require to do. And again, it's emblematic of the fact that we do have good planning across our local council colleagues. And Ken Ratton has been particularly helpful in discussions with undertakers and others in that vein. You will then see at 4.13 the information around the vaccination programme. We've obviously touched on that a wee bit just over the last 10 minutes or so. And as things stand at the minute, we have got really good uptake across our over 65s, with over 80% uptake in the respective categories within there. We've got over 90% coverage in our care homes, and generally we are doing pretty well against those areas that we see as the elderly population and those that are seen as frail and vulnerable. Again, like the rest of the country, we have not seen the uptake that we would have liked to have seen across those who are described as immunosuppressed or severely immunosuppressed. Currently, we have opened the vaccinations to the 50 to 64-year group, and we're sitting around 49% of those people having put themselves forward to get a vaccine. Again, we're going to be pushing to try and get that number increased as well. So generally we are on or above the national average for each of these cohorts, with the exception of the frontline healthcare staff. And I just described recently what we're doing to try and get that improved. You'll see also at 4.15 we're very conscious of the pressure on our staff, and both the Council and Health Board have put specific provision in to try and support the staff's health and well-being. And very importantly, at 4.18, we are engaging in a communications campaign that, again, we work across our partners to try and maximise the messaging going out to our wider community. You will see at item 6, we are still finalising the financial position. Again, some of that recognises some of the uncertainty that we have described throughout the meeting thus far. And finally, I would take members back to paragraph 2 and the recommendations, namely that the planning arrangements be noted, that the potential need for additional support is likely, and the ongoing work we've got with Scottish Government and our partners to conclude the financial arrangements. And again, happy to take any questions.
Thank you, Craig. I've got a question from Councillor Anderson.
Thanks, Chair. I've got a couple of points. First, I'd like to praise the staff for achieving the 95% figure for discharge in time. I think that's very good, very important. Could I ask, what are the plans to maintain and improve that figure during this winter period, which normally sees an increase in demand right across the board? And on page 60, 4.3.7, can I ask which voluntary partners are involved and in what capacity will they be employed to support safe discharge plans on time? Thanks.
Okay, thank you. So in terms of the patients who have been discharged without delay, yes, indeed, that is something we are really working on. You know, we've described in the work in the report some of the things we're doing around the discharge without delay programme, but we are specifically doing a piece of improvement work across each of the 3 hospitals. We're going to particularly concentrate around the care of the elderly wards, such that we're trying to implement something called planned date of discharge. So if we know that Mr Cunningham is due to be discharged on the 16th of November, we can make sure that we've got the care package in place for that date. Some of the work of the Home First team that was talked about earlier comes into play there. The localities are trying to make sure that they have got themselves lined up to be able to get the care in place. Where possible, trying to get the patient home and do the assessment for what they need in their own home, which is going to be a much more accurate reflection of need than an assessment in a ward environment, which is strange to them. And then beyond that, that also then allows us, if we've got the planned date of discharge, we can try and make sure we've got the ambulance organised, we can make sure that we've got the patient's discharge medication organised, and in turn then we can try and get the patient out before lunchtime, which in turn frees up the bed for somebody else to come into it. So that comes back to that bit I'd said earlier around flow being absolutely pivotal to keep that process going. And so if we're able to maintain 95 or even reach 96% of patients being discharged without delay, that helps maximise that flow through the system. So that's the main areas we're working in terms of there. In terms of the voluntary organisations, there's a range of voluntary organisations that are involved in this. We have worked closely with VASLAN to try and coordinate that on our behalf. They know the sector better than we do, and they have specifically sought a range of different voluntary organisations across each of the localities. And the main areas they're going to be looking at is providing telephone support to make sure people are feeling supported, they're all right. They might be able to organise some provisions to make sure people are able to get the type of support they need. There might also be support for transport, where patients might need to move from area A to B, or maybe offsetting difficulties in access to the ambulance service. So there's a range of work, there is a range of work that the voluntary sector are doing, and it's across a range of different partners within there.
Councillor Faulkner.
Just two questions. On page 60, 4.42, a new electronic scheduling system has been implemented across all 4 localities. Some of you may recall that I've continually raised my concerns about the scheduling system, where workers were going to their bed at night and on one end of the scheme we got up in the morning they were changed to the other end of the scheme. And I was assured at that time by a senior officer, which was taped, that this new system was working extremely well. On that point, if it was working extreme, why have we got a new one? And could I know what is the turnover of staff in the scheduling team? Recruitment and retention of staff.
So thank you, Councillor Faulkner. So for clarity, when it is not a replacement electronic scheduling scheme, so what that relates to is the scheduling scheme that you've previously discussed here and we've covered here at committee. So that confirms that the scheduling scheme is now rolled out across all 4 localities. This isn't a replacement. This is the one that we've been working on for some time now. So that rollout is now completed. I don't have the information to hand in terms of that, but I'm happy for us to come back to you in terms of your questions around churn within that part of the service.
60, 4.43, the Council's statutory duty to undertake assessment and also to review the assessment. Who does that?
The social worker's function to review assessment being supervised by the team leader, Councillor Faulkner. Does the social workers have responsibility to assess the care manager? No, the social worker, it's the care manager. Or it can be identified other as a social work assistant, for example.
Okay, Councillor Allison.
Thank you, Chair. First thing is you've been highlighting maximising flow and discharge without delay. And I'm pleased to say that out with Lanarkshire there has been concerns that that is being done at the expense of having care packages in place when required. Can we first of all have an assurance that that won't be happening within South Lanarkshire or Lanarkshire Health Board in general? Second point to do with the care packages, I'm finding that in the rural area, some of them are taking a considerable length of time. I had one example where the hospital had said a person was ready for discharge. 3 months later, still in hospital because we could not get a care package. That is only an example because it has been sorted. Thank you. And finally, one of the problems we have, or NHS has, is the number of people turning up at A&E because they cannot get doctor's appointments. Is there anything we can do to alleviate that problem and therefore reduce the pressure there?
Okay, so I'll pick up the GP issue and Suman will pick up the home care provision position. So in terms of the access to GPs, it was timely that there was an article folk might have seen on BBC News yesterday around the demand that has been placed on general practice and the staffing issues that they face therein. And Lanarkshire is no different to other boards. And in all probability, I would say we've probably managed to retain GPs probably more than most other boards, but there are still huge sustainability issues out there in general practice. And again, it is a whole system issue. So one of the things we are seeing now is that where patients would previously have gone to their GP, the GP would then have referred the person to secondary care for access to a service. Because there's delays in being able to access those services, what that means is that the patient then has to come back to their GP to potentially get more medicine, pain relief. In turn, they might be off their work and have to come back and get medical certificates signed to say that they're not fit for work. If they find themselves out of work, they're then back to the GP for support to access things like potentially mental health support, counselling support. So what would previously have been one single appointment and the person referred and seen in secondary care, that patient can now be back to the GP 4, 5, 6 times. All of that then is adding on to the burden in primary care. In addition to that, whilst we have put additional support in around things like pharmacists, additional treatment room services to support nursing, we are still seeing a demand that the GPs and the respective practice team are finding very difficult to meet. I don't think it's. I think we need to be very careful that you're saying something like patients are all going to the A&E department instead of the GP. When we actually look at the flows coming through A&E, what we're finding is that patients tend to be sicker than they were pre-pandemic. And we think some of that is down to the fact that they weren't able to access things like screening services. They might not have accessed the tests or the diagnostics that the GPs already referred to. So the GPs potentially referred many of these patients to the hospitals, but because of the delay in getting into the hospital, they've then reached a stage where they need to be admitted or they need to present to A&E. So there's lots of issues within there. And one of the things that we are very much doing is trying to make sure that we are getting the right support at the right time. So, for instance, if there is somebody who thinks they need to be seen urgently, they can go through NHS 24. In turn, they will then go to the Flow Navigation Centre through the hospital, and the hospital can then decide what's the best way for the person to access the services, such that it isn't always accident and emergency. But generally, we do recognise that A&E attendances have gone up, and likewise demand in GPs have gone up as well. So it's part of that overall capacity dilemma that we're facing.
Thank you.
Thank you, Craig. Thank you, Councillor Allison. So I'll pick up on some of those points. Just tying off the point around general practice, and this relates to another theme that's gone through this report, and indeed the previous items around workforce development that we've talked about here in committee. I would also highlight that, as Craig has said, it's about the right person, the right time, the right place. So one of the things that I think elected members can do who have access to more information on some of these matters than many of constituents is about emphasising that in general practice, as is other parts of our health and care system, there's a range of staff now. So once upon a time, if you went in to see your practice, you were only looking to see the general practitioner and possibly the practice nurse. Nowadays, though, within general practice, it's a multidisciplinary area. So actually the number of advanced practice practitioners we have who are able to do prescribing, a whole range of other supports in diagnosis and interventions is much higher than it's ever been before, whether we were talking about advanced nurse practitioners, allied health professionals and other colleagues. So one of the things here is to just make that distinction between people having access to practice in the way that Craig says, but also providing them with confidence they don't, in many cases, need to actually be seen by a doctor. And that actually the other professionals within the practice are more than qualified to provide them with the support that they need. In terms of your points around packages of care, so in terms of the discharge without delay process, as Craig said, that's absolutely about flow. So what we're doing there is essentially making sure we start planning with our acute colleagues at the earliest opportunity for somebody getting ready for discharge, which means that they're much more likely for their package of care to be ready. A challenge across all hospitals across, again, Scotland and indeed the 4 nations of the UK is that if you only start doing discharge planning, in other words, lining up a package of care that's been in place previously at the time of somebody being medically fit, then you just have to, you start building in quite a long delay because you're having to wait for either the in-house service to get those arrangements in place or indeed an independent provider to have those things in place. Because packages of care, as some colleagues here will recognise, are delivered by people. And people aren't just sitting around waiting to just provide that care. That takes time to organise. With planned data discharge and our overall approach here, it's about planning at the earliest opportunity so we can improve that flow. So it's not about people being taken out without a package of care who've previously had one. It's about doing that in a much more seamless fashion, into a much more timely fashion. The other point, though, tied into that, though, is to recognise that when we talk about assessments for packages of care, that's a social care function, it's not a healthcare function. So, as Craig's talked about before, you get a much more accurate assessment, certainly for those individuals who need it, by assessing them in their own homes, rather than seeing them within the sterile environment of a hospital ward. It's also important for us to recognise the longer somebody stays in hospital, the poorer it is for their own health outcomes and their own well-being, not least in terms of deconditioning, which is certainly something we've seen repeatedly for people who've had long delays. And similarly, then that essentially blocks a bed, which has implications for other people in terms of their care. So it's important to recognise that this isn't a one-size-fits-all approach. Most people are discharged at a hospital requiring any package of care. The vast majority of people who require package of care get it when they need it. For those that don't, it'll be some cases where they didn't require one before they went in, and actually, if the situation is markedly deteriorated when they're in, absolutely steps will be taken by hospital-based social workers, but otherwise the better assessment is to be undertaken when they are home. And that is how we'll be complying with our obligations to those individuals and looking after their care. The other things I would highlight is your point about rural packages of care. And again, whether it be yourself or indeed other members, I'm very conscious around how long individuals are often having to wait in hospital. That's not unique to South Lanarkshire. It's across Scotland, as you'll all be very much aware. That, though, takes me back to my earlier point about workforce availability. So the rate limiting factor for packages of care across Scotland, across the 4 nations of the UK, is around availability of a workforce to provide those packages of care. So when, again, we talk about a social care crisis, it's a crisis of the availability of staff to deliver these packages of care. We are struggling to make sure that we've got the full complement, hence why I will not give a guarantee to the committee about our ability to have it fully staffed. But as colleagues have talked about, we've got a range of activity to boost our in-house services and to deliver those in as efficient and innovative manner as possible. We also work very closely with the independent sector to ensure providing support for them. But that's one of the reasons why we've been very clear and vocal with our colleagues at government level, nationally, around the fact that we need to really boost the value that we place about social care as an area of work professionally, that we need to look at terms and conditions on a national basis to make sure that there's a more consistent approach in how we address these issues. But also critically, we have an upfront conversation with the public, individuals who require package care and their families, about actually what they should be expecting. One of the areas I know many of you will get questions about from constituents will often be, why is my package of care being reduced? We will reduce packages of care when we found that actually people are having a higher level of support than they actually require. So the analogy that we'll use for members here is around prescribing. So many of you will be familiar with the idea that people will be given a medication and it will run for some time. But as we know from lots of work that's been undertaken, including leadership of the Chief Medical Officer, that being on a high level of medication that you don't require for too long is bad for you. It's wasteful of resources and it's not good for your health. So actually the reason we work very hard through our pharmacists and our other colleagues is to review people's medication packages to bring it down at an appropriate point. The same thing applies to our packages of care. So one of the things, when we do this work very well, and that's one of the key elements around our Home First project, it's about actually making sure we're actively enabling people to be as independent as possible, which means that over time, from some of them, not all of them, but many of them, they are able to provide support without our interventions to the same extent, and that consequently releases capacity that we can apply to support more people given the growing demands in front of us. There are no magic bullets here. There are lots of people in our community in our hospitals waiting far longer than anybody on this panel would ever want, but we are doing our best to work through what is not just a South Lanarkshire and Lancashire issue, but a national crisis. Thank you.
Thank you. I have Councillor McGeevert.
Thanks, Chair. And that last answer actually covered quite a bit of what I was going to ask, so I won't waste the committee's time by rehashing it. Just the one kind of thing I had, or two minor points I had outstanding, and looking for a bit of clarification around. With regards to the 95% of patients being discharged from hospital without delay, does that 95% cover patients discharged after admittance to a hospital ward, or is it everyone who presents at hospital? Because, for example, if I go in, as I have occasionally with a football-related injury on a Monday night, and I'm quickly seen and, it's fine, I can go, am I included in that, 95%, or is it patients who are on a hospital ward and much more likely to be relevant to the issue? And just secondly, And apologies here if I'm substituting this committee, so I may not have the background that might be, other members maybe do. With regards to discharge without delay, is there any sort of issue, because I've heard of it from people I know who work in hospital settings, that where a person, usually elderly, frail, and who's in receipt of quite a broad range of care at home, comes in for a relatively minor need, for example, maybe the district nurses couldn't change a catheter that had fallen out or something like that, and because of the staff patterns or whatever, they may need to be admitted to a ward, to a urology ward to have that done. Is there an issue that their care package then gets paused and that restarting it takes time? Or is there a hold on their care package so that it continues in knowledge that they could get out a day or two later? So, thank you.
Okay, yeah, so thank you for that. So the first question around the patients discharged without delay, that's for patients who have been admitted. So if you turn up at A&E and you get an x-ray and get sent home, you're not included as part of that. Conversely, if you were admitted to get a procedure undertaken for day surgery and you're then discharged on the same day, you would be included within that. And likewise, if you were admitted to get your hip replaced and discharged 6 days later, then again you'd be included as part of that. In terms of the people who are admitted because of an acute issue, particularly for older people, that is very much one of the areas that we are targeting, such that we are, so we literally, this discussion at a session we had last Friday, each of our localities will get a note of everybody who's been admitted the day before, and they in turn will proactively reach into the hospital to say, by the way, Mr Cunningham, I see was admitted last night, can you tell me why? And because he's got a home care package, he's got our integrated community support team wrapped around him, we can provide much of what might otherwise be provided in the hospital here to try and get that person home before they are admitted. Part of the difficulty is when patients are old and frail, they do have lots of different things going on. They're not always guaranteed to be seen by a senior clinical decision maker, depending on when they're admitted. And in turn then, if they do end up being admitted, quite often people will try and fix things that they've been living with in their own home environment. So if we're able to make sure we've got that proactive communication with the hospital, then the idea is that we would try and get them back as quickly as we can. And we would also make sure that if there's a care package, we wouldn't give that away if we knew they're going to be discharged within 24 hours, 48 hours.
Okay, thanks, Craig. Just before I go on to Councillor Frame, I think obviously there are a lot of concerns around delayed discharge and care packages. We've all experienced it from working with carers and families in some very heartbreaking cases. And as Craig says, there's a whole range of things going on through winter planning, and you'll see from the next paper as well, in terms of staff complements for strengthening assessments, social care work, multidisciplinary team expansion. There's a whole plethora of measures that are being taken to tackle this. And also in relation to the GP point, maybe we need to have a louder conversation with people in terms of making them aware that they can see other health professionals. I have to say though, when we discussed that, yourselves and Suman and Craig at the pre-meeting, we actually did raise that. There are a number of recruitment issues around there as well. But the point I was going to make in this, I think it's important for this committee that we have an evaluation of all of this and that we can measure the impact because we are targeting it, there's funding going into it, and I think it is really, really important that we are cited in this and that we can demonstrate that it is making an impact, and if it isn't making a sufficient impact, what action we then need to take, albeit it is very difficult circumstances, but as members know as well as I do, there's some heartbreaking situations out there and we need to be sure that we're doing the right thing and that these measures are actually impacting. So, I mean, not for today, but obviously at future meetings, if we could, see an evaluation framework of some sort, being developed and reported to this committee on a regular basis, that would be good. With that, I'll go on to Councillor Frame. Thank you.
Thanks, Chair. Just got a couple of questions. The first one is about your, obviously making a smoother pre-discharge and starting earlier. Does that include allowing people back into hospitals to conduct their pre-assessments instead of having to do them over the phone? Because more since COVID and then obviously after the pandemic, things are still being done over the phone. So to make it a smoother discharge and to ensure that they're going into the, people are getting the right care, is we're going to be allowing people back in to do the pre-assessments in the hospital. And the second point I've got is at the last committee, we brought up about the scheduling programme that's being used to schedule carers' jobs for the day. And I'd asked if we could go back and ask the families and the clients themselves how they thought that was working for them, is to see if there's been any update on that. Thank you.
Yes, Simon.
Okay, so in terms of the pre-assessment or the engagement with assessments, again, that's all part of some of the improvement work we're talking about, where we're going to be making sure that the hospital team are aware of what the person's needs were prior to admission, and indeed, how do we then make sure that we've got the linkage to support the discharge. Beyond that, there's also work that's been done around patients who have either been admitted from a care home or identified as requiring to go to a care home at time of discharge. And we've got our care home liaison nurses linking with the care home managers, such that we're trying to smooth that pathway as well. And one of the key bits around that is also being able to try and support discharges at the weekends. So again, we're trying to make sure that the flow is maintained and we don't have this drop-off of discharges Saturday and Sunday, which then means that folk are coming into a difficult position on the Monday. In terms of the other bit of the question, I'll hand you over to Scott.
Scott.
Hi there, thanks for coming, Councillor. We are just about to embark. Every year we embark on a large-scale survey of all service users and staff. And we're just about to do that. It's always scheduled for around about this time of year. But this year we've integrated a number of additional questions into the survey, asking people about their experiences around the scheduling system, about staff continuity, etc. So it would be my expectation that we'll be able to get a really good return in terms of getting to find out what the views of individuals are. I'm happy to report back on that once the kind of results are back.
Thank you. Don't have any further questions or points. Can we agree the paper? Thank you. We move on to items for decision. Item 8 is the paper Strengthening Assessment and Review Capacity, and it's pages 69 to 72 in your pack. And I would invite Scott to speak to this. Thank you.
Thank you, Chair, and good morning, members. This report seeks committee's approval and proposes to utilise slippage from the Home First programme to address a backlog of assessments review, which have essentially resulted from the pandemic and contribute to action to improve unscheduled care. As outlined in Section 3, the Council has a statutory duty to undertake an assessment of an individual's needs and to complete this within 28 days of its commencement. There is also a statutory duty to review their needs on an annual basis or more regularly if indeed their needs or circumstances change. In addition to that, there's a regulatory requirement on all care at home providers, that's both in-house and external providers, to review the support plans of service users on at least a 6-monthly basis. Previously approved proposals on the introduction of the Home First approach and increasing social work assistant capacity within the care at home service will address assessment and review within the service going forward. However, there is a substantial backlog of assessments and reviews as an inevitable result of the pandemic and ongoing demand and capacity challenges. And as a result of that, there's a need for additional fixed-term capacity to address this, particularly given current social worker grade vacancies and the need to ensure that we have sufficient capacity to ensure safe and manageable caseloads in line with the recommendations of the Setting the Bar report. We have made progress in outstanding internal assessments and reviews, and that's been focused on as part of the remobilisation. This includes addressing any immediate service user concerns that are reported by service users, staff, providers, or other people who are involved in the care of the individual. Nonetheless, having reviewed the situation and given the anticipated ongoing demands on the service, officers have identified there's a pressing need to accelerate activity to reduce this backlog to provide assurance as to the safety, the health and well-being of service users and to ensure that the services appropriately meet their needs. Section 4 highlights the current position and notes that the Commissioned activity is currently running at 14 months behind, with internal activity also experiencing delays. Internal care at home services benefit from routine communications between staff and assessors about the changing needs of service users, with support plans routinely revised to ensure that they're appropriate to meet the individual's needs. That practice is a wee bit more limited for services that are commissioned externally, and there is confidence that targeting work around assessments and review activity will release much needed capacity that can then be redirected into areas of pressure. A conservative estimate, and I do say conservative estimate of this, is that we feel that we could reduce externally commissioned services by roughly about 5%. And if in doing that through targeted assessment review work, that would release roughly around 1,500 hours every week. And to put that into some kind of context, that's the equivalent of about 70 care packages at 21 hours. Indeed, it's the equivalent of about 105 packages based on the average package of about 12 hours. And we believe that could be achieved, and this capacity can contribute considerably to managing current pressures being experienced by colleagues in acute settings and help us to further support hospital discharges. The staffing proposals are summarised at section 5.1, and you'll note that funding for these fixed-term posts has been identified from the slippage in Home First programme expenditure. And its use here would be in accordance with the criteria for the ring-fence funding from Scottish Government to manage the pressures on unscheduled care and contribute to action to reduce delayed discharges. I should note that the recommendations or the proposals highlight some permanent posts and also some fixed-term posts. At the end of the 18-month period for the permanent posts, we are suggesting they would then be transferred to vacancies within the establishment. So this is very much a time-limited piece of work which will help us to get through the backlog and back onto a kind of sound footing. And lastly, if I could refer committee back to section 2 within the report, committee is asked to approve the recommendations highlighted, and I'm happy to take any questions. Thank you.
Thank you, Scott. I've got a question from Councillor Anderson.
Thanks, Chair. Page 74.7 is about the recruitment of staff. We've heard quite often, even today, about the difficulties in filling the current vacancies we have. So how confident would we be in recruiting extra staff for these positions, and in particular the ones who would be on a fixed term period of 12 months? Most folk now are not taking up part-time jobs or fixed-term contracts. Other departments within the council have abandoned that and tried to just go for permanent positions. So what's the chances of us actually recruiting all these folk for these positions? And would they take precedent over filling the current vacancies that we're struggling to fill? Thanks.
Scott.
Thank you for your question, Councillor. I think that's a really fair point. What I would say, firstly, is that whilst we have some real challenges around recruitment to certain posts, namely frontline social care workers and social worker grades, we've had a lot of success in appointing to social work assistant posts. So we are confident that we'll be able to appoint to these. But I think the rationale that you highlighted is one of the reasons why we've got a mix of permanent and fixed-term posts here, because you're absolutely right. I think a permanent post is much more appealing to people, and what you'll see in terms of the the one team leader and the 7 social work assistants, is we're looking to appoint them on a permanent basis. And at the end of the 18-month period, which would be used for this exercise, we would then look to divert those posts into vacancies within the service. We also have had some recent experience of recruiting temp social work assistant posts for a fixed period, particularly given following on from a report that the last committee approved, and we've had a lot of really good interest for the posts. So I think I'm relatively confident, I have to say, that we will be able to appoint to these posts. They seem to be very different from the front line or from the social worker grades, and we're getting quite a lot of very good quality applications coming through.
Thank you. Councillor Faulkner. Listen, your light's not coming up. Right.
The delays in the assessments, and we heard earlier that the assessments are the responsibility of the care manager and the social worker and the social work assistant. So obviously due to COVID they weren't able to do that, but I find it quite astonishing that we're spending £500,000 on social work assistants and team leaders when we've already paid for that in the wages to the care managers and the social workers. And if you actually break it down, it's about 5 a day of the year. And the care commission are appreciating the fact that these were delayed due to the COVID. And other authorities that I see have actually allocated 3 or 4 cases to each of their social workers and social work assistants. For us to spend £500,000 now when we're going to get into our budget and into a rise in council's tax, I think is not the best use of our resources. Thank you.
Thank you. Scott, you want to respond to that? Scott, you'll need to request to speak again.
Apologies for that, it wasn't working for some reason. Thanks for your question, Councillor. I suppose a number of points. The first one would be to highlight that the funding stream for these posts is coming from slippage money. So that slippage money is ring-fenced by the Scottish Government, specifically for the management of pressures in relation to unscheduled care and to contribute to action to reduce delayed discharges. So it's not money that could be utilised in other ways other than for that kind of key purpose. I suppose the second thing to say is that as has been reported, I think, a number of times to committee, there are significant vacancies, particularly within the social worker grade across South Lanarkshire. So one of the rationale around this is that we know that we can bring in social work assistants to support this work. We don't currently have sufficient capacity within the resource at this moment in time, particularly when you take into account the recommendations of the Setting the Bar report. So the Setting the Bar report talked about safe and manageable caseloads for staff of between 20 and 25. So we're trying to look to do something which will help us to accelerate the pace of this work to mitigate risks, but also hopefully then to release capacity, which will help us in the face of what is unprecedented demand at a time which is exceptionally challenging. I think we've spent a lot of time at today's committee talking about some of the real difficulties we have in terms of securing care packages, some of the real difficulties we've got in terms of staff shortages. So, you know, right sizing packages for people is really important. We want to make sure that people have the right support, but if there's the potential, as Suman has previously highlighted, for us to reduce packages to enable that to be recirculated into supporting someone else, that's really important for us. So I think it's more about the fact that it's about capacity, it's about how we use the funds, and it's about trying to then get an outcome at the end of this which will help the wider system.
Thanks, Scott. Yeah.
Scott mentions that the money is ring-fenced and that they've recruited social work assistants before. If we look at the fact that social work assistants in South Lanarkshire are paid about £2,000 more than social work assistants in North Lanarkshire. But the other anomaly is, and where we're finding problems recruiting is in home care staff, and it's been highlighted today, the lack of care package has been ready when people are discharged from hospital. And I'd have thought it'd been a better, not to tell management how to do their job, but I thought it'd been a better use of the money actually increasing our home care staff salary, which is £2,000 less than North Lanarkshire. Thank you.
I think that's a different process, Alan. I'll let Suman in.
So just to clarify, so as members will know, we have the job evaluation process there in terms of grading, so that's separate from the work that we would do as a management team within resources for quite legitimate reasons, as members will know. And the other point, just for clarity that Scott said there, so yes, the money is ring-fenced, it's also slippage. So this is one-off cash. When you raise someone's salary, you raise it on an ongoing basis. So you couldn't, even if you'd got a job evaluation outcome that took you to that place, you could not use this money to do that.
Thank you. I don't have any other questions. Do we agree the report?
Agreed.
Thank you. Item 9 is reinforcing safe staffing in older people's residential care staff banks, pages 73 to 76 in your papers, and I would invite Martin to speak. Thank you.
Thank you, Chair. And this one picks up on the theme that's been run through committee this morning, just around workforce availability. And this particular report, which is very short, relates to the care home setting and the establishment of a bank or supply bank for staff within the care homes. We did pilot this through COVID, and that was seen to be very successful, as you'll see in section 3.4 of the report. So what we're really looking to do with committee's approval is consolidate this arrangement, and you'll see in section 5.1 of the report how we intend to do that. So what we're looking to do is recruit an admin a resource around this, just to obviously support the infrastructure around it, and this relates solely to in-house care home services. So I'm not going to go through the report in any detail. Hopefully it's fairly self-explanatory, and I'd turn committee's attention back to section 2 of the report and the recommendations and ask that they be approved.
Thanks, Martin. I've got a question from Councillor Watson.
Thanks. I'm assuming that MD taking part in this wouldn't be asked to do any tasks that they're not trained to do in our care homes, and that they'll not be forced into positions where they're doing work that they're uncomfortable with, because anecdotally that's what I've heard has happened previously, that staff have gone into these care homes to act as support, but then when they get in there, uncomfortable, we're getting asked to do tasks that they're not trained to do or comfortable doing. Thanks.
Thank you, Councillor Watson. I'll let Martin come back in a second, but just to provide reassurance to committee members, so anything that we do within our residential care homes is in line with our regulatory requirements and registration requirements for the Care Inspectorate. And they're very clear, and as this paper goes, this is about safe staffing arrangements, so absolutely we are committed to ensuring we have safe staffing arrangements, so that means the right people doing the right roles and the right jobs within those establishments. If you have any examples, and this applies to all members today, if there are any specific examples you've got in terms of concerns, where concerns have been raised by individual member staff or others, could you please bring that to my attention? One of the things I'm very keen to do is not kind of trade in anecdotes within these committees, but if there are specific examples, please bring them to our attention and we will properly investigate them. Thank you. Martin, is there anything you'd like to add?
Not much further than that, other than to say these are all obviously existing social care staff within South Lanarkshire, and obviously they'll be SSSC registered, etc. So anything we would do would be supplemented by any training specific to that individual care home that they'd be working in.
Okay, thank you. I don't have any more questions. Do we agree the report?
Agreed.
Thank you. Item 10, enhancing capacity and support of adult disability payments. It's pages 77 to 80 in your pack, and I would invite Martin again to speak to the report. Thank you.
Thank you, Chair. And again, another short report here. Again, picking up on this theme running through committee this morning, just of workforce and how we support frontline, etc. Just by way of background, the payments around people with a disability is changing. You'll maybe have heard in the national press, etc., that Social Security Scotland have now taken over work previously done by the Department of Work and Pensions, particularly relating to disability living allowance and personal independence payments. So with that changing, there's a slight way in which or how this is administered. And you'll see from section 3.4 of the report that describes the process and how that's changing. What does this mean for Social Work Committee? Well, it's quite straightforward in terms of what we need to be doing to support this. Most of this will be done through Social Security Scotland, looking at information around assessments and obviously information provided by the person themselves or their carer. Where that isn't the case and there needs to be further information sought, what we're then being asked to do is work with Social Security Scotland with the permission of the individual themselves to provide further information as to determine whether or not they qualify for that's disability support. So in terms of our particular service, what this may mean is we're contacted directly by Social Security Scotland to provide information in relation to someone who has maybe got a disability or is currently being assessed for a disability. All current people who are on a disability living allowance payment or a PIP will automatically transition onto this new arrangement. So as it stands just now, we've not had a lot of requests, but those requests could go up because it's now open to new applicants. So how we intend to resource this or how this will work is it will come through, we'll be requested by Social Security Scotland to provide information. We've got 28 days to return that information. That information will relate to how a person's level of independence and how they go about their daily living tasks. So the support around this is more one where we need to respond within a 28-day timescale and provide information in relation to their assessed need. And there is money, as you'll see in 4.4, around funding support for this. That currently stands at 223,000 in terms of the South Lanarkshire share of this. That's only for 1 year, so that may well diminish over time. We don't know, or it may well increase, but I think in all likelihood it's probably likely to either stay the same or go down. So as it stands, section 5 of the report outlines how we intend to use this funding. So there's an administrative element to this funding, but there's also an assessment or professional overview aspect to it as well. So what we're asking committee to do to support this is we're hoping to add some capacity into the existing admin service and also the front line to deal with any increased demand that we may get to meet this 28-day timescale. So I'll turn committee's attention back to set the recommendations of the report and ask that they be approved. And I'm happy to take any questions.
Thanks, Martin. I don't see any questions. Oh, sorry, Mary Donnelly.
Is this the one that's going to be coming through the Scottish Government and it'll have a much more humane way of operating to ensure people are reaching their full potential and their benefits?
Thanks, Councillor Donnelly. Yes, this is a more consolidated way of doing this, so it's through the one organisation and it's through the one payment. So the actual process for how that's done, it will mainly be through a health assessment or a social care assessment in terms of whether the person's eligible or not. As I said, nobody will be penalised who's already on a disability living allowance payment or is on a PIP. So in that respect, they'll automatically transition over.
Catherine. Sorry, Thanks, Chair. It's just, how would this impact us? Would it be our responsibility to continue this process if the money was not available? And have we fed this back to the Scottish Government about how we would be unable to provide this service if we didn't get the ongoing money?
Yeah, so you saw there, Councillor McClymont, there's 223,000 in place to support this in this financial year. We've yet to understand what we're getting in the next financial year. A lot of this information already exists just now, so if we're contacted about somebody that's known to social care, then there'll be an assessment in place, and it's a matter of us retrieving that information in line with the questionnaire that Social Security Scotland would submit to us. As it stands just now, the demand for this has been very low. So we think we can reasonably cope with that. We've coped with it as it stands just now within existing resources, so because we've yet to recruit to these posts. So that the allocation next year will be very much dependent on what's happened in this year and years going forward. So if the demand spikes around this, the funding should follow suit, that actually it's proportionate to the level of requests that we're getting. Most of the requests so far have gone through things like GPs and NHS colleagues so far.
Thanks, Martin. I don't see any other questions. Do we agree the report?
Agreed.
Thank you. Item 12, scheme for curator ad litem and reporting officer. Sorry. Item 12.
No, item 11. That was item 10.
Oh, sorry, I've skipped on, sorry. Enhancing resilience of mental health officer provision, and it's pages 81 to 84 in your report, and I'd ask Michelle to speak to the report. Thank you.
In respect of funding that's been made available by government to recognise the pressures within mental health officer services. Certainly within South Lanarkshire, our mental health officer services are located within 4 teams out in localities, headed up by team leaders. We also have a couple of posts are working in local offices, and we also have a social work team at the State Hospital in Carstairs. When we were made aware that funding was available, we looked at our mental health services and we looked at where the challenges were. And if I give you an example, as of 31st of March this year, within South Lanarkshire, we had 1,071 guardianship orders. That's 6.3% of all guardianships in Scotland, so with the third highest rate in Scotland. So we've got demands around guardianship, adults with incapacity. We've had waiting lists for assessment, and we've been progressing that. We also, as a mental health officer service, provide a daytime and an evening duty rota as well. So there's a lot of challenges on the service, but we do have officers in post, and we looked at where the pressure points were. The pressure points were for social workers within the community mental health teams to carry out functions of assessment and review. So when we've looked at the availability of the funding, looked at the pressures, looked at the demands, our view was that we needed more social worker posts located within the community mental health teams, which would augment and support the functions of the mental health officer. So in essence, it will allow the mental health officers to carry out and focus on the statutory elements of the role, while allowing the assessment review functions to be taken on board by social workers. So you will see within the section of the report, sorry, I just jumped here, 5.1, the recommendation and request to committee is that we use this funding for 4 social worker posts. We already had a 0.5 mental health manager post at State Hospital. That previously was a whole-time equivalent, but State Hospital reviewed their SLA, so they only require 0.5. We've exploited that opportunity because that's a very experienced mental health practitioner manager, and we are seeking approval to augment that to a full-time post, because that will permit support to the fieldwork localities as well, and support the fieldwork managers and their teams in the direction and delivery of mental health services. So the request is for the funding of the posts to be social worker posts. Thank you.
Thank you. I don't see any questions. Do we agree the report?
Agreed.
Thank you. Now we're on to item 12, scheme for curator and ad litem reporting officers panel, and it's pages 85 to 96 in your pack. And I would ask Ian McRae to speak to the report. Thank you.
Thank you, Chair. The purpose of the report is to seek approval of the revised scheme for curator ad litem and reporting officers. I suppose just in terms of what is the role of the curator ad litem and reporting officers, and why do we need them? We're legally obliged or required to maintain a panel of curator ad litems and reporting officers that are appointed by the court. Their role is specifically to investigate the circumstances and report back to the court on circumstances where a child may be placed for adoption, or we're pursuing a permanence order for that child. The updated scheme in terms of, it was last negotiated in 2014, and there has been, as you say, the updated scheme, which has been negotiated between, obviously, neighbouring local authorities and the Sheriffdom of South Strathclyde, which is Dumfries and Galloway, with the Larnack and Hamilton Sheriff Court, and the faculties of lawyers are supportive of the updated scheme. The updated scheme, I suppose, will bring greater consistency across the local authorities. It will increase the pool of creator ad litems and reporting officers. And it also obviously will create obviously that necessity to update membership and widen that pool, as I say, for a more wider kind of expectation of people who can apply to become creator or reporter officers that may have different qualifications and experience, because it's felt at the moment it is unduly restricted. There has obviously been, I suppose, some thoughts that in the last number of years that the scheme hasn't kept up to pace with solicitor fees, and obviously there's the proposal will bring about obviously parity with other local authorities in the payments. I can just bring your attention obviously to Appendix, the implications, the financial implications that are outlined in Appendix 1. As it said, there was certainly a negotiated position, rising obviously you'll see from £300 per report previously negotiated in 2014 to £600, and where there is a dual role for the creator ad litem and the reporting officer, and a reduced role if it's either one. Obviously, the recommendation today is to ask the committee if they would approve the recommendation on the the scheme is actually approved in terms of its recommendations. Thank you.
Thank you. I don't see any questions. Can we agree the report?
Agreed.
Thank you. We now move on to items for noting. And item 13 is the Lanarkshire Care Academy, pages 97 to 102 in your pack, and I'd ask Aileen to speak to the report. Thank you.
Thank you, Chair. So the purpose of this report is to provide an update on the adoption and development of the Care Academy approach in South Lanarkshire. Members will be aware that this is a key action within the Social Work Resources Workforce Plan in terms of promoting social care as a vocation in South Lanarkshire and looking to reinforce and expand routes into social care as a career. So the progress of the Care Academy will coordinate the activity of partners throughout Lanarkshire with a view to increasing the number of employees entering social care and the healthcare workforce. So in terms of the Care Academy, it's been progressed on a pan-Lanarkshire basis to build upon the coexisting operation between the North and South health and social care partnerships. There's already a Care Academy in place for North Lanarkshire, and the plan is for this to be expanded on a Lanarkshire-wide basis to strengthen the existing links, reduce the duplication and share learning. So the vision of the North Lanarkshire Health and Social Care Partnership Care Academy is to encourage more residents to choose a career in social care, and this aligns closely with the Social Work Resources Workforce Plan to create pipelines into social care as a career. So in terms of the current position and the current activity, there are a range of initiatives that fit into and enhance the Lanarkshire Care Academy, and they're listed in section 5 of the report, and I'll just outline some of the highlights. So our Modern Apprenticeship programme, there's currently 18 social care modern apprentices and a further cohort that are planned for 22-23. For developing the young workforce through the Youth Employability Services, the young people in the senior phase of school can access foundation apprenticeships in social care, and there's currently 37 pupils engaged in this activity. And in addition, there's 48 pupils undertaking the graduate programme in social care. We have 10 existing employees that are undertaking a professional apprenticeship, and they're being supported to undertake a professional qualification from across care at home, daycare and adult residential services. Also, there is a range of employability services to support the care sector, and the team offer a targeted approach to fast-track residents into social care, and this has been used in our current care at home recruitment here at South Lanarkshire Council. There are links with colleges through the practice placement programme, and this is used to create a route for students to secure posts within the council. And finally, the Care Academy is being developed to support the Keep the Promise commitment for care experienced children, young people and their families. So moving on then in terms of next steps, there's already a draft memorandum of understanding that to formalise the Lanarkshire-wide Care Academy approach. There's a steering group that has identified 3 work streams on which the council will be represented, and the work streams are developing the young workforce, employability and inclusion, and recruitment, attraction and retention. And in addition, there's recent research undertaken by the Open University about expanding learning within high SMID areas. And as this is developed, that will also be incorporated into the Care Academy. So if I can refer a committee back to section 2 and ask that the recommendations be approved in terms of the content of the report be noted, and that further updates in terms of the progress of Care Academy are provided as appropriate. Thank you.
Thank you. I have a question for Councillor Logan.
Thanks very much. Colleagues, I think this morning some of the papers, it's been a bit gloom and doom, and we're worried about winter coming and staff retentions and all the various things. And right at the end, we've got a nice wee golden nugget here. And I think this is one of the best things that we will undertake. And I'm so pleased that it's going to be Pan-Lanarkshire. Some of us actually live sitting nearly in the North Lanarkshire borders. Some of our children actually go into North Lanarkshire schools. So Pan-Lanarkshire is good that it's encapsulating everywhere and everyone. And I think it's also right that for a long time, and probably still, social care, social work hasn't really been high in people's agendas. So to have foundation apprenticeships or modern apprenticeships and all the various things, this is where we have to capture youth coming through to bulk up our workforces. And I think it's an excellent way to do it. And just my final wee question, I was just speaking to somebody who works within the council, and they were hoping to maybe upgrade their own qualifications. But when they looked at it, it was too expensive for them to take it through themselves. Are we hoping to maybe extend or expand maybe something where people could retain our own staff at the minute, could actually sort of take courses to upgrade themselves? Would that be anywhere near this? Or it's excellent for this part, but also to give our own staff, what's the word I'm looking for, but, you know, it would be good for them if they thought that they could, you know, progress as well. Thank you.
Thank you.
So in terms of this professional apprenticeships, that's the part about supporting existing employees with qualifications relevant to their role. But yeah, I take your point about promoting also this is a career for other employee members, and yeah, that is a route. So employees can use the appraisal process to discuss career development, for example, if they're already within the existing social care workforce, in terms of that pipeline and that career path and where they see themselves going. Likewise, if they're not currently sitting within the social care workforce, they can still use that opportunity to discuss with their line manager, or indeed to come through, whether it's through HR or ourselves, to see what the possibilities are. I can't guarantee that we would be supporting everybody, but obviously we would be taking into account the individual circumstances, and it is something that sits within this framework.
Thank you. Councillor Allison.
Thanks. I agree with the importance of this academy, as to what Councillor Logan was saying. But what I'd maybe like to hear more about is how it's going to operate. Is it an online learning experience, or is it based in Hamilton, or where is it based? Because one of the concerns I would have is a lack of access from the from my own ward in particular, but the east, south and west of South Lanarkshire in general, there are insufficient links in transport to be able to access the more central areas, and how you are going to deal with that.
So in terms of links to learning places, there are a number of places across the authority, across both North and South Lanarkshire, where people can link into learning. But a lot of the learning in terms of gaining some of the professional and vocational qualifications is actually done on the job. So a lot of that is promoting that, and this, as I say, is very important to this framework. But there is a variety of ways that people can access the learning, and it's not necessarily going to be limited to one location or one locality indeed.
Thank you. I don't have any further questions. Do we agree the report?
Agreed.
Thank you. Item 14, Bairnshouse update, pages 103 to 106, and I'd ask Ian McCrea to speak to the report. Thank you.
Thank you, Chair. The purpose of this report is to update the committee on the progress of early implementation of the Bairnshouse in South Lanarkshire in line with national developments. I suppose very briefly, the kind of vision is Scottish Government's vision is that all children who have been the victims or witnesses to abuse or violence will have access to a Bairnshouse by 2025. Now, what is a Bairnshouse? A Bairnshouse is a collaborative approach to investigation, interview and recovery for children who have experienced abuse or witnessed violence. It brings together in one building police, forensic medicine, social work, children and adolescent psychiatry in terms of its main functions. The idea of the vision and aspiration for Bairnshouse is that it is one that is child-centred, and by bringing this collaborative approach together, it would coordinate, it's designed to coordinate and reduce the number of times that children have to recount their experiences to different professionals and different groups as what is experienced just now. Obviously, all the care and support and recovery that the child and family will need will be delivered under kind of one roof. So it's very child-centred in its nature, and it is, as I say, a model that's been experienced already in more of the Scandinavian countries, particularly Iceland. So in terms of its development and where we're at in South Lanarkshire, again, it's at very early stages. There has been national standards that have been developed in relation to the Bairnshouse. They will guide national development and local developments of what the Bairnshouse should look like, because there's lots of debate about should this be a co-located one building, or is it an approach using the principles and standards? And that's still being debated nationally, and we're at the table in terms of South Lanarkshire in relation to those debates. And that is pretty much coming from the challenge of bringing all services together under one roof, and what that would look like across Scotland, particularly for areas where there are rural and geographical challenges. So certainly it's being decided. So in terms of our readiness, I suppose, in South Lanarkshire is that we, along with North Lanarkshire, where we piloted an approach to a new way of interviewing children 2 years ago. We have fully embedded this approach, and in terms of, we were one of the first pilot areas in Scotland, and we do feel like there is a state of readiness in terms of the social workforce so far, if we were to look at how the Bairnshouse would look like in South Lanarkshire. Obviously, there's discussions about whether these barn houses would be regional in terms of the economies of scale as well. So all of that obviously hasn't been decided, but it was important obviously to obviously bring this report to committee so that there's early discussion and early sight of some of the discussions and negotiations that are happening nationally. There has been a national strategic governance and oversight group that has been established, and we are sitting at the table in terms of, as you say, negotiating, discussing how the barn house could be delivered across South Lanarkshire. In terms of the financial implications, as I say, the report right now, because we are at quite early stages, there hasn't been any financial framework that has been, or modelling that has been discussed or negotiated at this stage, and we will keep you obviously abreast of any future developments around the barn house development in South Lanarkshire. I'm happy to take any questions. Thank you.
Thank you. I don't see any. Sorry, Councillor Donnelly.
And it's really nice, as we were the first pilot 2 years ago, to be bringing this on screen. I also would like to commend, and I don't know if you said it wrong, but the Bairns Hoose, which is Scots language, and that's nice to see us promoting the Scots language as well in the name of this project coming forward. But I've got nothing but praise for it. We are going to be linked with Women's Aid, are we?
Yes, Councillor Donnelly, we will be looking at recovery services, specifically, as you say, those in relation to Women's Aid and other therapeutic services for children and families.
Fantastic. I can only commend it so highly. It's fantastic that we're bringing this on screen.
Thanks, Councillor Donny. Could I just ask a quick question? Apologies, I should maybe have asked at our pre-meeting. Where does this take place at the moment? I assume we have safe places, designated places where we do this work just now, and what we see. I can see obviously the additionality of this. It's a more structured framework towards it, but it's just for information. Where does this take place at the moment? Thank you.
So at the moment, we do have a safe place. We're co-located. So we're probably one step ahead of some of the other local authorities. We're currently co-located social work and police at the Blantyre Police Station. We have a very trauma-informed way of how we interview children. And we have already had the experiences of families and children and young people who have been interviewed through this new model have early indicators would say that those children have, they've made disclosures. Those disclosures have been taken seriously and they have been acted upon and they're being supported in their recovery. So we do, yes, have a safe place. I think the difference with the Barnes House will be bringing, as you say, more collaborative partners on board, including the recovery services as well.
Thank you. Thank you. I don't see any other questions. Do we agree the report?
Agreed.
Thank you. The final item is item 15, notifications of contracts April to September 2002, and it's pages 107 to 112. And I would invite Martin again to speak to this. Thank you.
Yeah, thank you, Chair. This item is just for noting and is just a notification of the contracts and tenders that have gone out since across the period April to September 2022, and obviously relate to those that are above the 50,000 mark. You'll see from the appendix there's a broad mix of care at home providers on that framework and advocacy, etc. But beyond that, I don't have anything to add to the report, Chair.
Thanks, Martin. I have a question. Councillor Faulkner.
Aye, it's just in page 112, the second one down, Adigo Care Limited. Is that not the Care Limited that opened at Peacock Cross there and it's now shut and for sale?
don't know the exact detail behind that, Councillor Faulkner, but I can certainly find out for you and get back to you.
There's a for sale sign up. It's only open about a year.
I'll check that one out and come back to you.
Thank you.
Thank you. I have no further questions. There are no items of urgent business. So, sorry?
Do we need to agree on that?
Oh, sorry, I take it we've agreed. Item 15. Yeah.
Agreed.
I have no items of urgent business, so could I thank everyone for their attendance and their contributions, and could I thank the officers for their contributions and all the reports that have been tabled, and also Tracy for the admin support, and Catherine. Thank you. Thank you.